Today's tip addresses the elements that need to be included in proper progress notes. It is extremely important to properly document your progress note so that anyone who views it has complete and detailed information for treatment and funding purposes. The chief complaint addresses why the patient is in your office today, which may include an acute problem, a follow-up visit to review labs, consults, or inpatient stays, medication refills, and monitoring of current chronic conditions. The HPI summarizes the patient's current condition and clarifies the chief complaint. The HPI should include at least 3 current chronic conditions and should never include the words history of. The PFSH can include diagnostic tests, results, and dates of service. It should also include allergies to medications and the medical, surgical, and social history of the patient and the patient's family. A good history helps you figure out what is currently going on with your patient. A full capture visit will probably need a complete review of systems. Keep in mind that a review of systems is unnecessary and non-compliant if the chief complaint and the HPI do not justify it. Your examination should detail what the patient says and what you are seeing, hearing, and sensing. Document pertinent assessments that provide support of your diagnosis. A comprehensive exam is not needed unless the chief complaint and HPI support it. You must not contradict anything in the note. For example, the exam cannot state that the patient's skin is within normal limits if you are dealing with any skin problem, such as a rash, in your assessment and plan. In your assessment and plan, make sure that you support each diagnosis compliantly and completely. Addendums should have the current date and time, the reason for additional information being added, and they must be signed. Keep in mind that addendums are the exception to the rule and should never be used for new diagnoses. If diagnostic results come in and a new diagnosis needs to be added, have the patient come back and complete a new progress note. This needs to occur within 30 days of the prior progress note, or it is a late entry per AHIMA and CMS. Remember to always say what you see. Thank you for watching. I'm Dr. Diaz, and this has been your MRA Tip of the Day.